What is inhibitory control? Inhibitory control is a core executive function that involves being able to control one's attention and thoughts in order to override a strong internal predisposition. For example, inhibitory control is resisting the urge to interrupt someone during a conversation. Inhibitory control first begins to emerge near the end of infancy, around 9 to 12 months of age. At this stage, we might see early signs like a baby pausing before reaching for something they're told not to touch. Then, during the toddler and preschool years, inhibitory control rapidly matures. This is when children start to better resist impulses, follow instructions, and wait their turn. This growth is closely tied to brain development, especially in areas like the prefrontal cortex, which is responsible for higher-level thinking and self-regulation, and the parietal cortices, which help with attention and processing sensory information. Altogether, these brain changes support the child's growing ability to manage their behavior, focus their attention, and control their responses. Difficulties with inhibitory control are linked to several psychological and developmental disorders. One of the most well-known is ADHD. Children and adults with ADHD often struggle to resist impulses, stay focused, and delay gratification, which are all key components of inhibitory control. Autism spectrum disorder can also involve challenges with inhibition, particularly in areas like repetitive behaviors or difficulty shifting attention. In substance use disorders, poor inhibitory control can contribute to difficulty resisting cravings and making long-term decisions over short-term rewards. Finally, individuals with anxiety and mood disorders may struggle to inhibit negative thought patterns or emotional reactions, which can intensify symptoms like rumination or emotional dysregulation. But why? Inhibitory control isn't just about behavior, it also plays a key role in regulating our thoughts. For example, when an unwanted or negative thought pops into our mind, inhibitory control helps us stop or suppress that thought so we can redirect our attention to something more positive or relevant to the task at hand. This ability is especially important for maintaining focus, managing emotions, and supporting mental well-being in everyday life. This is why it is so important to develop inhibitory control skills. While inhibitory control naturally develops over time, there are also strategies that can strengthen it at any age. One effective method is meditation and breathing exercises. These practices help increase awareness of your thoughts and emotions in the moment, which makes it easier to pause before reacting, to resist impulses and stay focused on your goals. Another powerful approach is mindfulness-based cognitive therapy, or MBCT. This combines mindfulness techniques with elements of cognitive therapy to train the brain to manage distractions, stay present, and reduce impulsive reactions. By regularly practicing these strategies, we can actually improve our ability to regulate both behavior and thought over time.